This video is for anyone who is feeling IT band pain, and specifically IT band pain typically happens around like your lateral knee. Your IT band iliotibial band is a thick fibrous band, and it runs from your hip down to your knee. So it attaches right up here at your hip. You're not going to benefit yourself by trying to stretch or roll the band itself. The band itself is not flexible, and it's not going to stretch. So in order to take the pressure off at your knee where it's pulling, what we're going to do is we're going to work this other attachment point at the hip. And you'll find that if you find this spot, the TFL is specifically the muscle up here at your hip that you want to get to relax and release. Then it will stop pulling down here and you will find some relief. So what you want to use is something like a lacrosse ball. I'm using a lacrosse ball today. This works pretty well because it's hard, but it's not rock solid. A tennis ball might be too soft. You can play around with like a different size balls, but a lacrosse ball tends to work really well for this. And so what you're going to do is you're going to lay on your side, and you're just going to stick this ball sort of in this hip pocket. So it's going to be below like the bony hip bone that you're feeling, and what you're going to do is just sort of stick it in there, roll around until you find a spot that's like, ooh, oh my gosh, like that feels really tight. And so what you can do is just lay on your side, rolling around some on top of that ball until you just feel like, oh, there it is. I found a spot like that feels tender and some tightness and soreness there. And then your whole goal, we're not making a pain face. We're breathing through all of this. And what we're trying to do is we're trying to get that point to just relax and release. And so as I roll around a little, and it's just really gentle movements in there. It's like, oh, okay, there it is. Find a spot, do what you can to like just really relax, breathe, and like really let your body weight sink into the weight of the ball. And if you do that just for a couple minutes, at some point you'll feel like, oh, things start to relax somewhat, and then it'll stop pulling on that band. And then it'll stop pulling on your knee itself. The other thing to think about is that if your IT band hurts, it's because that TFL is tight, it's likely that the root cause. So what we're doing with this is we're not fixing the root cause. This is like a Band-Aid fixing the symptoms to take the pain away in like an acute sense. But if your IT band is giving you problems when you run, usually it's when you're running, sometimes cycling is involved, then what you're going to want to look at is your actual hip movement and the stability that you're getting through your hips. I'll argue against doing specific hip strengthening work for this in favor of and it's not that we don't ever want to do hip strengthening stuff. Like hip strengthening stuff is good, but before we do that, you want very mobile hips. And so you want a pelvis that is not stuck, it's not twisted, it's not like stuck in an anterior or pelvic or posterior pelvic tilt. You just want it to be relaxed and mobile and moving. And in order to achieve that, going back and watching a lot of the videos that I've posted here previously in the Monday Movement playlist will help you get your hips mobile and moving. And from there, you may find that they function a lot better when you go running, even if you didn't do a bunch of specific hip strengthening stuff. After your hips are in a good position and they're moving well, then adding strength to that stable platform already is a good thing to do. But if your hips are not in a good place, just strengthening them from a place of dysfunction is literally just strengthening the dysfunction. So get your hips open and mobile and moving first. Using this in your TFL will help just alleviate that pain. But then after you've alleviated the pain, go back and fix the root cause.